Marinaldo po sa gabos na delegates ta sa Bicolano Young Leaders Congress. It's an honor for me to be able to share some stories with you in this Congress. No? So allow me to share my screen. So in the next few minutes, I wanted to discuss 5 stories and share 5 stories with you. No? 5 kwento uh, na mahalaga sa konsepto ng leadership. No? And I was tasked to talk about leadership of the self, which I think cannot be separated from our desire to lead. Where does it come from? And sometimes when we're called to leadership, we tend to want to change something. No? Yung mga kwento pong ito ay may tema po na kaya nating baguhin ang sistema. At 5 po yung kwentong ikukwento ko, stories from 3 different coalitions and civil society movements that I am part of, and part of the work that we do in We Solve is to support these civil society movements and collective action movements to push for systems change. No, so 5 pong kwento. Yung una, maniwala. Pangalawa, makipagkapwa. Pangatlo, makinig. Pang-apat, magsaliksik. At panlima, manindigan. Simulan po natin sa kwento ng isang koalisyon. Yung una po ay maniwala. Para po sa mga nagko-commute dito, naranasan nyo na ba to? Na ma-stuck sa traffic ng 3 oras, na parang sardinas kayo sa mga bus o sa mga tren, o kung meron naman kayong pribadong sasakyan, ma-stuck kayo ng napakatagal, napakalapit lang, pero nandyan kayo, o minsan kapag uuwi tayo, diba, ng Bicol, napakatagal ng biyahe natin. At marami nagsasabi tong problema ng trapiko ay isang bagay na hindi kayang masolusyonan. May nagsasabing imposible tong masolusyonan kasi parang ang hirap-hirap ng problema at sasabihin nila at they point to different cities. Sasabihin nila, oh, hindi naman tayo tulad ng Amsterdam, hindi naman tayo tulad ng Hong Kong, hindi tayo tulad ng Seoul. Pilipinas tayo, wala nang pag-asa yung Pilipinas. Kasi kahit isang bagay na araw-araw ko nararanasan, diba? Araw-araw ako nagagalit dahil stuck ako sa traffic. Hindi natin masolusyonan bilang isang bayan. And they point to these cities, actually forgetting that there are cities as well that experience the same problems that we have today. Actually, yung picture po sa kaliwa, that's actually a picture of Amsterdam in the 1970s. Hindi po yan Ortigas Avenue or hindi yan ADB Avenue. Hindi yan Peña Francia o hindi yan Magsaysay Avenue. Yan po ay Amsterdam in the 1970s that also experienced the same gridlock as some of our emerging cities are facing. But there was something that changed from the 1970s to today. At kung nakita niyo po sa picture ng dito sa kanan, may nagbago. Nakita niyo po, mas may puno, mas maraming nagbibisikleta, mas maraming naglalakad, mas komportable yung daan. Kumbaga parang para sa kanila, nasolusyonan nila yung traffic sa lugar nila. So, parang hindi po necessarily totoo, na parang imposible talaga masolusyonan yung traffic. So, paano nga ba masosolusyonan yung traffic? And if you click on this link, and I hope you see this, makikita niyo po, parang it's a highway that has more than 10 lanes. Dati punong-puno sila ng pribadong sasakyan ng kotse. And this theory, actually napakasimple lang po, ng theory on how to solve traffic, the theory of traffic evaporation. You make people shift from their private cars to cycling, to public transport, to pedestrian, to walking. And you can actually reduce the number of lanes that you have for private cars, which are actually a very inefficient way of moving people. And you can leave space for plazas, for housing, for parks. And so, in theory, kaya nating masolusyonan, kaya nating mabago yung bulok na sistema ng pampublikong transportasyon o ng traffic by moving people and not cars. No? By making sure that our cities are built for people and nature and not for cars that only rich people could afford. No? Only 6% of Filipino households, for example, ang may pribadong sasakyan. So yan po kung paano masolusyonan yung traffic. No? So di ba nag-start tayo parang, parang imposibleng mabago yung bulok na sistema na yan. Pero ngayon, nakikita natin, posible. Pwede tayong manalig na pwede pala siyang mabago. And in fact, para sa maraming mga tao no, na nagsasabing na wala ng pag-asa ang sistemang to, sometimes it takes just a little bit of research to be able to divide that big, complex problem into manageable bits and see that we can, in fact, help change the system. One of the reasons kung bakit po many people despair is because they think that it's something that the problem is something that only I own. But hopefully in the course of this presentation, you see many examples of people coming together and helping change this system. But in order to do that, kailangan po nating manalig, no? Kailangan nating maniwala na may pag-asa, no? Na kaya nating baguhin yung sistema na to at meron tayong ambag sa pagpapabuti ng sistemang to. So how do we go from this big complex problem into understanding what our response will be to changing this system? No, what I propose is a 5-step engaged citizenship framework that might allow us to discover what our calling might be in helping change some of these social issues. The first is we start with a big problem. And halimbawa po, no, road transport contributions to the climate crisis. And that local problem manifests in traffic and mobility in Metro Manila and even Metro Naga. No, you see many areas in our province, no, in our region, no, that are now becoming more congested. And you see many roads, no, marami pong mga lansangan sa atin ang they keep on widening those roads, no, without giving adequate space for walking, cycling, and public transport. And so what happens is, no, even if you widen the road, more people want to drive cars. And that theory is called induced demand. Start with that big problem, no? And the bigger it is, and the scarier it is, and the more despair-inducing it is, the better. No? So start with those challenging problems. The second is, we try to research on these problems and we try to research on these big numbers. So, in the climate crisis that we're facing as a generation, no more than 1/10 of global carbon emissions are actually coming from road-based public transport like private cars. And it's also an issue of equity. No, meron po tayong malaking inequality sa ating mga lansangan. Buses and jeeps, for example, carry 72% of people but are given only 13% of road space. There are many, in our budget, for example, 2.8 trillion pesos was budgeted for road transportation, but only 1% of that budget was given to road-based public transportation, like walking, cycling, and public transport. Even if 94% of Filipinos do not own a private car. So, ang dami pong mga injustices na ganyan, no? Yung mga kawalang hustisya. But when you research on these big numbers, we're able to see that we can tackle the problem in many different angles. The third is we map those institutions that move these big numbers. So we see that some of these institutions are in fact important. No, we can engage the national government. We can engage our local government in pushing for bike lanes. We can push the Department of Transportation to work on better contracts for transport workers so they don't have to close, because of the boundary system. We can work with the Department of Health in pushing active transportation for better health We can push the Department of Public Works and Highways to have better design standards their for their roads, no, and highways that are now really, really built for cars and not for ordinary Filipino commuters. We can also join private firms in infrastructure and construction. We can join media because they help in changing people's hearts and minds about a certain topic. And we can join civil society. We can join the academe to research. No? Then we try to understand the teams. How do we train to join those teams to become the best people in those teams that solve this problem? So we can join the bus or the rail team or the active transport team. And we can study different fields. No? We can study transport economics, philosophy of the city, information design, communication, humanities, engineering, etc. The flip side of having a complex problem po, no, na maraming sanga-sangang issue, no, the flip side to that is whatever discipline you're in, pwede kang magkaroon ng ambag sa pagbago ng sistemang yon. And the fifth step is to deepen our purpose towards engaged citizenship. No, bilang isang mamamayang malay at kayang manindigan. Na it really starts with listening to others as we journey from self-awareness to engaged citizenship. And this journey of engaged citizenship can start with, the dreams that we wrote on our yearbooks, when we were young, we were kids, starting with, I want to be an economist. But an economist for what? An economist for whom? A doctor for what? A doctor for whom? A lawyer for what? A lawyer for whom? A politician for what? A politician for whom? A leader for what? A leader for whom? Para ano? Para saan? Para kanino? And those dream statements might take a better shape, no? Mas nagiging klaro pagkatapos ng 5-step method na to, no? And here's how it may sound, no? Globally, a tenth of carbon emissions come from road-based transport, mostly from cars. In the Philippines, a fifth to a third of a poor family's income is spent on transportation. I know the poor are disproportionately affected by long lines, choke points, climate crisis impacts, and air pollution and congested roads in Metro Manila and even in my city, no, in Metro Naga, in Metro Legazpi, near Daet, everywhere. And so I'm called to improve public transport in my country. I want to see a fair and just transportation system that moves people, not cars. I know I'm good at and interested in economics, so my specific response to this call is to become the best transport economist who can perform route planning for the Department of Transportation, even build bike lanes for the Department of Transportation, or improve the system of cycling in my city by joining the city government or the municipal government or the provincial government. To start living out my purpose, I must study economics, read lots of books on transport, research on this question for my thesis, and seek internship opportunities in this field. And yung may kita po natin dito sa paglalakbay na to towards engaged citizenship, we start with anger. No, we start almost with a sense of despair. Nakakaasar to, nakakagalit tong bulok na sistemang to. And we're able to realize by listening to others, by engaging with our communities, na meron pala akong ambag sa pagpapabuti ng sistema. No? At ang puna, at ang kritisismo, at ang pananaliksik ay ambag din. Kailangan una maniwala tayo na kaya nating mabago ang sistema. Pangalawa, hindi po tayo nag-iisa, meron po tayong mga kasama. Kailangan nating makipagkapwa. At yung pangalawang kwento naman pong ito ay tungkol sa Citizens Budget Tracker. No? Na ito isa po tong grupo ng mga volunteers, no, na tinatrack yung budget, no, at katuwang actually namin yung Move as One Coalition sa pagpapabuti, no, ng sistema ng budgeting, no, sa Pilipinas. No, kami po yung isang grupo, no, na nagtatanong lamang, no, lalo na nung pandemic, ano ba yung maitutulong namin? So nag-start siya nung may mga kapamilya ako frontliners na hindi makakuha ng PPE. So nung March 30, 2020, I started asking questions. I started asking our governor questions. Just to read the status, may mga rural health units sa hospital po digdi sa Camarines Sur na di pa natatawanin commitment or exact date kung rin mapapadarahan ng PPE. Pwede pong maaraman ang mga plano ng Kapitolyo kung anong aldaw po makakapa-deliver sa inda ng protective equipment. So, while someone in the provincial government was able to talk to me, hindi rin po naging clear kung kailan yung commitment na yun. So what we did was we did a private donation drive and we were able to get some PPEs from VP Lenny Robredo's office then. No? So, pero yung sunod na tanong dito, parang hindi ba dapat may budget para rito? Hindi ba may batas na ipinasa para magkaroon ng PPEs yung mga kapamilya kong frontliner dito sa Bicol? Kaya nagsimula 'to sa isang maliit na post, 'no, yung budget tracker nagsimula sa maliit na post. April 1, nagtanong lang ako parang may gumagawa ba ng tracker on Philippine government budget allocation and spending on COVID-19. Noong April 2, nagkaroon na ng version 0 no, after 24 hours. No, and I published the first version of the tracker just on Google Sheets, napakasimple. Just compiling all the information that was present during that time so that everyone could make sense out of the budget and out of the law that was being passed then. So nagsimula to sa maliit na post at tumugon sa tawag yung mga tao. No, yung mga data scientists, tinanong namin kung pwede silang tumulong. Yung mga auditors at accountants, tinanong namin kung pwedeng kaming tulungan sa pag-double check nung ilan sa mga accounts sa aming tracker. Hanggang sa lumago yung komunidad, hanggang sa naging 60 plus na kami na auditors, artists, lawyers, social workers, researchers na at coders, no, na nagsasabing, uy, may karapatan tayo bilang mamamayan na malaman kung ano yung nangyari sa buwis na binayad natin sa pamahalaan. And the most recent one, the most recent study that we did in 2021, na naglabas din kami ng report tungkol sa financial statements ng Pharmally Pharmaceutical, no, na apparently marami silang mga produkto, no, marami silang mga masks and other types of medical goods that were apparently overpriced, no, according to the Senate investigation. And apparently si Pharmally, it wasn't big enough to be able to actually be contracted by government, no, for these types of contracts. Masyado silang maliit para sa bilyong-bilyong pesong kontrata. And what we saw from the Senate investigation was apparently they were people who benefited from that who privately benefited from this public emergency. Pero nakita natin dito, it started with just a post and then people wanted to help, no? At dito ko nakita na sa pakikipagkapwa na to na uy, yung Pilipino hindi siya yung sinasabi ng mga tao at ibang mga politiko na pasaway, 'di ba, walang disiplina. Kapag binigyan mo ng Pilipino yung pagkakataon na makatulong, tutulong, no? So wag tayong maniwala sa mga nagsasabing, 'di ba, parang walang disiplina yung mga Pinoy to just to justify you know, dictatorship, to justify authoritarianism, to justify them saving us, no? Kaya mahalaga po, no, na makipagkapwa sa isang demokrasya. Yung pangatlo po, bago tong kwento na to, dito po sa pakikipagkapwa ng Citizens Budget Tracker, no, dyan po kami na-recruit into the larger Move as One Coalition movement. Nasabi ko po kanina, 'di ba, na napakaliit yung budget natin para sa public transport, no? At the most important intervention that we can have, no, in pushing for better public transport services is to actually invest more. At itong grupo na to, naging part yung Citizens Budget Tracker ng larger Move as One Coalition movement, which is a coalition of around 140 organizations pushing for safe, humane, and inclusive public transport. And the system, this particular part of the system that this group wants to change is yung bulok na sistema ng pagbabudget. no? Which is actually a law that should be passed by Congress. And what we've done over the past few years was, since 2020, we were able to push for around 30 billion pesos, more than 30 billion pesos in budgets for protected bike lanes, for better contracts for transport workers, and for a just transition for transport workers. No? And that's the reason why, for example, even if pop-up pa lang yung mga bike lanes, no, parang makeshift pa lang, nagkaroon na, no, may pagbabago nang nangyayari. But it was because of people first believing, no, nananalig na kayang mabago yung sistema, at nakikipagkapwa, no, coming together to be able to push to change the system. So posible tong mabago. Pangatlo naman, makinig, no. So sa pakikipagkapwa natin, mahalaga na makinig tayo sa kapwa natin, no. At itong kwento na to, it's a very local case. The last three stories, in fact, are stories from Tarabangan Contra COVID-19 in Naga City, which was our civil society movement that worked with the city government of Naga, and our district representative and the office of the vice president to be able to lower COVID-19 cases in Naga City. So, kailangan makinig. Ang aramta na ang Tarabangan, no, ay it's a Bicol term for pagtutulong-tulungan. Yung Tarabangan po, isa po kaming non-partisan group seeking to collaborate to strengthen Metro Naga and Camarines Sur's coronavirus and response and recovery efforts. No, meron kaming mga diverse representatives that really started with what we called community listening exercises. Nakinig muna kami sa rural health officers, doctors, field nurses, data scientists, business groups, restaurant owners, lawyers, religious groups, mga nanay, cultural and environmental groups, and civil society leaders. And what we did was we basically asked the question, in all of the COVID-19 response pillars, no, yung prevent, detect, isolate, treat, reintegrate, vaccinate, what has gone well so far in the city government's response, and how can we work together to improve it? No, so we worked with these diverse representatives to be able to push an agenda to our city mayor, because during that time, no, people were very uncertain. No, people were really grappling with this pandemic. No, and even a city government as progressive as Naga was also having a tough time because the virus spreads exponentially, no? And limited din yung resources ng city government. So what we did was we actually met our city mayor during this time crisis operation. So it was just a few days, no? We did those community listening sessions halos sunod-sunod, no? We asked for help from our city councilor, si Miles Arroyo, who's here. Mayor Nelson Legacion, our city mayor, ako po yan, yung katabi ni Mayor. Mayor, kami po yung nag-present dito. I was tasked by our team to compile our civil society's common agenda. No? And here in this group, nandyan yung mga members ng academe, ng civil society, religious groups. And we basically said, Mayor, these are the experiences of the people of Naga, and this is how we think we can work together. No? Ano po yung mga, how can we help? No? And the city mayor, in fact, gave us a seat in the Health Emergency Response Task Force. So that's the highest policymaking body on COVID-19 efforts in Naga City. That convened, I think during that time, since emergency yon, MWF kami nagmi-meeting. Ito yung open air venue kung saan kami nagmi-meeting dati. Yung key roles ng Tarabangan, yung una, nakikinig sa komunidad, nagbibigay ng independent feedback para sa COVID response and recovery programs. No? Again, nakasama kami sa task force meetings at nagda-draft kami yung mga tinatawag na citizens charters para sa testing, monitoring, isolation, and prevention. And in fact, naging implementing partner din kami sa ilan sa mga vaccination programs, testing programs ng syudad. Ayan, so nakipagtrabaho rin kami kay VP Lenny Robredo, no, in bringing many of these programs of the Office of the Vice President to Naga and our district. We also worked with the Office of Kong Gabi Bordado during this time. So we worked on targeted antigen testing, no. In order to make sure that this agenda actually happened, no, we needed first to research. Kailangan magsaliksik. At nakita namin during that time na napakahalaga ng testing, no, sa pagpapababa ng kaso para malaman natin kung sino yung mga na-isolate natin. So binaba namin yung programa ng swab cab, no, libreng antigen testing, in partnership with Metro Naga Chamber of Commerce and Industry, no, Angat Buhay, Kong Gabi Bordado's office in pushing that testing, no, for swab cab, targeted antigen testing. At the start of our programs, no, napakataas pa ng positivity rate, no. So during that time, I think Naga was entering a big surge, and during the start of the program, mga 15% yung positivity rate, no. Gustong sabihin, 15 in every 100 people tested were positive. Ang sinasabi ng WHO, dapat only 5 of 100 should be positive. Pero napababa namin by the end of the program na 1 month, napababa namin to just around 7.5%. No, we were able to have that number. And because we were able to identify more people and isolate more people, bumaba rin yung kaso. So napababa namin yung positivity rate at kaso noong July. We also did research, no, on how to improve our vaccination process. And one of our team members actually led this pillar. No, meron kaming parang 3 columns lang na pinakita namin sa task force. May observation, may recommendation, at may city response. So meron kaming mga dokumento na ganyan. That actually I can also share with you. I'll also share with you a copy of this presentation. So may mga information na parang hindi pa okay, no, kaya na-confuse yung mga tao kung paano pumila, kung anong oras dapat pumila, at nagsisiksikan, no, at ayaw natin ng siksikan, 'di ba? Kasi doon nagkakaroon ng COVID infections. No, we also worked with different groups like Rotary, JCs, for example, in working on these. Karoon kami ng pantry para sa mga volunteers namin. We also did prevention activities like Komunidad Laban sa COVID, which was the pilot. We were the pilot area of Angat Buhay's prevention program, no, where we worked with different community leaders to empower them to prevent the spread of COVID-19. No? Kasi naniniwala tayo na our communities are our front lines. No? So we did webinars, depending on the groups. We worked with Active One Health, which is part of the Unilab group, no, in empowering people with this information about how to prevent COVID-19. At panlima, pagkatapos makinig, pagkatapos magsaliksik, kailangan manindigan at kumilos. And it's very important to understand that, activism, being able to stand with people means the very basic thing. It means showing up. It means showing up in those sometimes really long but boring budget hearings, but they're very, very important in pushing for protected bike lanes in Naga City, in making sure that contact tracing and monitoring is implemented well. No? And here is in one of our late night meetings with the city government's contact tracing and monitoring team, who were our really strong allies in pushing and implementing these programs. It means sometimes the boring everyday work of looking at many different rules that the national government just releases without that much thought about local government's capacity to implement. So marami, for example, na standards on safety seal in businesses, but we innovated and really brought draft citizens charters and these draft safety checklists para isa na lang yung checklist para sa mga inspectors, para sa mga businesses natin. No? The approach isn't punitive, hindi ipapasara kita kaagad. It is, we will help you comply. No? We will make sure that you know what the rules are and how to protect everyone, and your customers and your employees. And we will help you comply. No? That's what empowerment means. We also donated carbon dioxide monitors for the City Hall, and in their safety checks. Dahil 'di ba sa COVID-19 mahalaga yung apat dapat, no? A is air quality, no? Kasi yung COVID-19 parang usok 'yan na nanggagaling sa mga hininga natin, no? COVID-19 is a respiratory illness. It spreads through air, no? And that sometimes these aerosols remain suspended in the air, parang usok, no? At kapag kulob yung lugar, mas kumakapal lang yung usok. That also means mas concentrated yung COVID-19. No, kaya napakahalaga ng pag-monitor ng level of carbon dioxide na nasa loob ng isang kwarto, at mas mababa yung carbon dioxide, but that means likely mas mababa yung concentration ng COVID-19 and therefore less deadly, no? There's less chance of you being infected with COVID-19. Kaya mahalaga na kung nasa venue kayo, dapat bukas yung mga bintana nyo. Dapat bukas yung pintuan, dapat maayos yung airflow, fresh airflow sa lugar natin. At syempre, kailangan mag-physical distancing, yung P, yung A, always wear your mask na high quality, and T, limit time of exposure with other people, especially yung mga kasalamuhan natin. We did also regular checks of establishments, no? Sometimes on our bikes, we just check if these establishments had their windows open. We saw that not many establishments actually complied with opening windows and doors to prevent COVID-19. And many people were not wearing masks properly. And we shared this independent feedback with our city government for improvement, no, in our COVID-19 numbers. And I wanted to close by summarizing, no, everything that we discussed so far. Para alam natin na kahit nasa una, meron tayong isang issue na heartbreaking, no, nakakagalit talaga. Baka pwede nating sabihin na parang wala nang pag-asa yung Pilipinas, wala nang pag-asa yung Bicol, no? Pero una, kailangan nating maniwala. Kaya nating mabago yung sistema. We can use that 5-step engaged citizenship framework to understand how we can contribute to solving a problem and how we can, what our calling is in leading. Second, makipagkapwa. We are not alone. We can work together in order to change things, as in the example of Move as One Coalition and the Citizens Budget Tracker. No? Hindi totoong walang disiplina ang Pinoy. In fact, mabait, may bayanihan. Totoo yung bayanihan ng Pilipino. Pangatlo, makinig. No? At nakita natin sa kwento ng Tarabangan kontra COVID-19 na pwede nating mapalakas yung boses natin kapag nakinig tayo sa ibang mga tao, and we arrive at a consensus, no? An agreement about what parts of the system of COVID-19 response, for example, needs to change, and work with the city government in order to improve that. Work with our respective local governments to do that. Pang-apat, magsaliksik. No? Good policy is based on good research. At panlima, manindigan. No? At kumilos. Kapag alam natin kung ano yung gagawin natin, and it's based on the proper evidence, we will be able to change any broken system that makes us feel despair and arrive at the other end feeling empowered. That we as citizens, we as Filipinos, we as Bicolanos can in fact change the systems that we want to change. Diyos mabalas po sa Indogabos, and looking forward to even more conversations with you. And I will leave with the organizers my number and my email address and my social media accounts. and I hope to continue this conversation. Thank you.